Welcome to Karibu Anawim's 15 Minutes at Dr. Zali's Desk special. Join us as we dive into the topics related to living with a facial disfigurement. Whether you're here for yourself, your loved ones, or for educational and professional insights, this is for you. We start our conversation with clear, understandable terminology. While we use disfigurement, it's for medical and legal clarity. We acknowledge you may relate to terms like visible difference or your own diagnoses. All our presenters have lived experience or work with people living with facial disfigurement. Curious to know more? So are we. Pull up a seat, grab a cuppa, and let's chat around the table with Karibu Anawim's 15 Minutes at Dr. Zali's Desk special.
G'day guys, and thank you and welcome back. Today we're interviewing Dr. Lowe, who is a cancer oncologist. He works and he has a special interest with facial nerve disorder, and he's a reconstructive surgeon as well. So with no further ado, I will add him to the stage and I shall welcome. Welcome, Dr. Lowe. How are you?
Thank you, Zali. Thank you for the invitation. I'm good. How are you?
Yeah, I'm all right. So I know that you're a reconstructive surgeon and you're an oncologist. But before we get into that, where are you from?
I was born overseas. I was born in Malaysia, and we migrated when I was towards the end of high school, and from then on, got into medical training, and pursued my career in surgical training.
Mm-hmm. So, and before we get into surgical training and medicine, what is something that you would like to share with us that you enjoy? Well, it could be an embarrassing moment if you dare, or whether or not it's a hobby that you enjoy on your time out.
The thing that I enjoyed a lot is the two things. So one is with the family. So I have a musical background, so I love playing music with my kids, and they are very talented in music, and we do a lot of chamber music together. And things I like to do by myself would be spending time in my garden, or in a big wide space. So I do all my gardening, I do all my hedging, all my lawn mowing, because that's my time.
If you want to do some hedges, I've got some out the front. they're very large.
It is very large.
Want some more time? You could just come over and just hedge.
Love to do that. It's one of those that is me and my time with the headphone on, and no one can disturb me.
No, I wouldn't. I would ask you whether or not you'd like a cup of tea. Would you like something to eat? That'd be yours. That'd be all yours. And then you can get it cut, directly. You can get it like that fine line that I can't do because I don't have the binocular vision to actually be able to do straight lines. So
I think even with binocular vision, sometimes you don't get it straight. You thought you got it right, and then you step back and go, overdone this.
Okay. So you were saying that you got into medical school and then you wound up in surgery, becoming a surgeon. So walk me through that.
So after finishing medical school, I knew I wanted to do things with my hand because I like playing music. I like gardening. It's all about hands-on. I didn't have a direction about where I wanted to go with the hand. So I started my training as general surgery. And the thought was that if it is general, I can do everything and I can figure out what I want. And that's how I started my journey. And I was fortunate enough to meet the late Chris O'Brien during one of my general surgical training and saw what he did for head and neck cancer. And that's where I decided that I wanted to be one of the head and neck cancer oncologists. And the journey sort of carry on. and from being a cancer oncologist, met other sort of other surgeons who are good at doing reconstructive surgery. So once you take it out, you want to be able to reconstruct the patient, and that's where sparked my interest in reconstructive surgery. So cancer oncologist, cancer reconstructive surgeon. And as I came back from Australia to Australia after a standing overseas, there was a niche in facial nerve that wasn't really met well in Australia. And this is where I pull all my sort of knowledge together and basically pull a team together. And we then started the Sydney Facial Nerve Service. That's how my journey sort of up to this point in time.
Wow. So it was just a spark off that man who I didn't write down his name.
It's a late Chris O'Brien.
Late Chris O'Brien. Oh, that's okay.
Yes.
Because it's the Chris O'Brien.
It's the Chris O'Brien Lifehouse that I'm working in.
Yes,
right.
That's what I'm.
That's right.
The penny's just dropped. The penny's just dropped. Okay, so what sort of challenges do you face with your patients or surgery?
I think the challenge with head and neck cancer is that they're very visible, and as you would know, the things on the face or things that doesn't look right is very different to things on the breast or things in the abdomen, because that's all being hidden away. So people know it upfront, and people look at you very early on, and you're being treated quite differently. So I think one of the things, and head and neck cancer is also quite challenging, because for a long time, this cancer has slightly worse prognosis compared to breast cancer. So when we meet a patient with head and neck cancer, and especially in my field where I'm specialized in facial nerve disorder, so they got a cancer, the face stopped working, and my responsibility then is to bring them through this journey, where the first step of the journey is on oncology, so cancer treatment, and then the further steps of the journey will be on the rehabilitation and coming to sort of then integrate them back to their activities. So this is where the power of reconstruction comes in, where you can actually start making that difference, and hopefully able to then get them back to where they were, as close to where they left before the cancer.
So you said, and I've just lost my train of thought. It's just gone. Oh dear. So what do you think is the most important part of surgeon-patient relationship? Or what do you think is important in, not the important part, but what do you think is important in the surgeon-patient relationship?
I think you need to build a rapport to start with, because that relationship is not a one-off relationship, it's a journey. And every oncology patient is a journey. So you wanted to you want them to have a very positive experience with the journey. Some journey end really well, some journey do not end very well, but the experience through that journey need to be as good as they can be. So that rapport is very important, and that trust. So once you build the rapport, you'll build the trust, because a lot of time the patient will need to trust you that once they've gone to sleep, everything is in your hand. And so the conversation before the surgery is important about what, I mean, with oncology, we need to tell them this is what needs to happen, because the cancer is unforgiving, and we do not cut corners on cancer. And we just need to be able to remove that, treat that. to be able to give them a good outcome. Now, from the reconstructive side, this is a slightly different story. It will be a conversation.
Before you go to the reconstructive side, how do you build rapport and trust? Can you walk me through how you personally attempt, because not always is it possible, but how do you try and build a rapport with your patients?
Some patient is a lot quicker and other patient a lot harder. So I think the first thing is be able to listen to their story, and at the same time maintain that clinical acumen that you want to do a diagnosis. You want to be able to diagnose things and give them the prognostication. But you will also need to listen to their worry, their concerns, and be able to address them as well as you can. Now, those worry and concern do change over time along that journey. And by not...
Can I be cancer-free would be the first thing, would it be?
That probably, I think that come up in the very upfront in the conversation. I think this is where the knowledge and had to be quite honest with the patient. Well, we in cancer surgery you have staging, so patient we got enough data now. If you have this and this feature, the chances of you being cancer-free in 5 years is this percentage, and this is where the knowledge need to come in. And we will need to be very honest upfront. This is what you have. This is your chances of being a disease-free in 5 years. Now, we don't know where the patient is on either side. Are they going to be cancer-free or not cancer-free? And what we will then need to walk them through is that what do we need to do to get them to a better outcome versus the poor outcome? And this is where research comes in, innovation comes in, and knowledge comes in.
And experience.
And experience.
and your skill base of actually surgery, yeah?
That's right.
Thank you. So now we've done the cancer bit, sort of in a nutshell kind of thing. And now can you talk to the reconstructive side of things? Because I stopped you and I wrote a note.
So in the reconstructive side, they in this sort of big cancer surgery, we not infrequently we have two teams. So we engage a second surgeon, and for the surgeon we decide who is going to do ablation, who is going to do reconstruction.
What's ablation?
Ablation means removing the cancer.
Right.
So that the rapport you build with the patient, you can tailor the rapport you build with the patient. Now, in certain cancer, especially the one affecting the facial nerve, I sometimes take the whole thing because it needed that workflow. So if I'm sort of coming as the reconstructive surgeon and say one of my colleagues is take on the role of the ablative surgeon, I will initially understand the oncology. So make sure that I understood what the cancer means, where are the potential morbidity from this resection, and then outline that to the patient. So these are the morbidity we're going to look at, and just then outline what is important to them. What do they expect out of this? Now, a lot of patients say, I just want to be normal, and that's fair. And I would tell him, and I would then turn around and say, look, this is what I can do to get you where we should be. Now, in some cases, if the resection is not too bad, we can get them almost normal. Some patient is normal, some people is close to normal, and we'll be very upfront with them. And we also will outline what are the rehabilitative steps that we will need in between that to get them to where they want it to be. And we will also emphasize that we will work along with the cancer. So all cancer needs surveillance. So we'll rehab and we'll do surveillance hand in hand. And that has to be, and those conversations will happen very upfront.
Well done. Thank you.
Pleasure.
So we've discussed what you do, why you chose to do it, which was Chris O'Brien's influence, and why you chose to specialise, and all sorts of challenges, and what you think is the most important part of the surgeon-patient relationship, which is basically build a rapport, listen to their worries and concerns, but also be objective with the work that you can do. Be honest and listen, and be upfront. So with what you can and cannot do, and maybe the prognosis of prolonging your life for 5 years, or possibly 5 years, or be cancer-free 5 years later, as opposed to if you don't do anything right now, then you may not be around for much longer.
That's correct. You summarized it very well.
So we haven't even touched the surface. Would you like to come back for another session?
I'd love to, Zali.
Okay. All right. Well, we'll say goodbye. Hang on. I don't have another person to do all this stuff with me, so we'll do this. So we'll say thank you very much for coming and sharing your wisdom and your experience, Dr. Lowe. And catch you on the flip side, everyone else. Bye.
Thank you, Zali. Thank you very much for the invitation.
Oh gosh,
See
it's
you.
the end of Karibu Anawim's 15 Minutes at Dr. Zali's Desk special. And that's a wrap for this episode. Thanks for tuning in. Please remember that all information given during this episode is for general application only. If you have any specific medical issues, as always, consult with your medical practitioner. Like, subscribe and share on whatever platform you find us on. For more information, please connect with Karibu Anawim on our website at karibuanawim.com or email us at inquiries@karibuanawim.com.